Hello and welcome to the second hour of Connect the World. I'm Eleni Giakos. Now, the Middle East is increasingly on edge amid fears Israel is moving its military focus to its northern neighbor. The leader of the Lebanese militant group Hezbollah is due to speak any time now after his fighters were targeted in 2 waves of attacks using electronic devices in Lebanon. But the harm done by hundreds of explosions in no way limited to members of Hezbollah. The group is blaming Israel for both attacks. Now, Israel is not commenting on either one, but CNN has learned that it was behind the first, in which pages exploded across the country. And we've seen new attacks across the border overnight. Israel's Defense Minister Yoav Gallant says a new era in the war is beginning, with a center of gravity for Israeli forces moving north. Lebanon says dozens were killed and nearly 3,000 wounded in the 2 waves of attacks on wireless devices. Last hour, I spoke with the Lebanese health minister. He began by explaining what the hospitals in Lebanon have been dealing with.
We've had 2 days where we had a large number of those who are injured coming to the hospitals. The total tally of those who are dead is 37, including 2 children, an 8-year-old girl and an 11-year-old boy. Now, in the hospitals, the vast majority of the injuries on the first day were mainly in the face and in the upper extremity. We've seen people who have lost their eyesight because their eyes have been damaged. And we've seen people where they have lost the use of their hands, whether they've had amputation of fingers or a completely mangled hand. And I think that a large number of those are going to have a life-changing injury to deal with.
Minister, you mentioned child casualties. Could you give us a sense or a picture of how many civilians unaffiliated with Hezbollah could have been caught up in this?
It's very difficult to say because, this didn't happen on a battlefield. I mean, even those who might be affiliated with Hezbollah, the vast majority of what we saw were civilians coming in. They were in a market, as some of the videos had shown. They were in the street, they were in their cars. Some of them were actually working in hospitals. We have a nurse who lost his, who died because of this. We have some other 3 healthcare workers who are severely injured. So this happened in a civilian sort of environment. It didn't happen on a battlefield. And that's why it's difficult to say, sort of differentiate between, let's say, competence and non-competence. And this is one of the reasons why Lebanon and the government considers this an indiscriminate attack, in the sense that, it's clearly when those devices were detonated, there was no concern that, there are civilians nearby and they might be injured.
So, Minister, here's the question, and we've seen some of the visuals and the video of various devices exploding in public spaces, as you say, even in a market, for example. What kind of injuries are we talking about here if you're just in close proximity of a device like this detonating?
So, there are 2 types of injuries that we've noticed. The first one, this is the pager. And here, what apparently happens is that those pagers went off. People were looking at the message, and then they exploded. And that explains why the main injuries are to hands and to the face, to the eyes. And these are the vast majority. We've had, up till now, we've operated on 900, or we performed 955 operations on patients. And as I said, a large number of them have lost the function in their eyes or in their hands. Now, on the second day, these were the walkie-talkies, which are bigger devices, and they caused a much bigger injuries, and a lot of those patients ended up either having extensive surgeries. And it also explains why we have a higher tally of fatalities in the second day. In the first day we had 12 deaths. In the second day we had 25.
Minister, 25. Minister, I want to talk about the ability for hospitals to deal with this kind of influx of injuries. And I know a lot of people are currently in ICU as well. Lebanon has been dealing with the lack of government funding, specifically to hospitals. We've been dealing with various crises. What kind of scenarios are we looking at here, your ability to be able to deal with these types of attacks?
Well, indeed, that was the main worry when the conflict started. And from day one, we were working on a scenario where there are mass casualties. Now, because, the health system is working in a low resource environment, then it became a very important role for coordination and for making sure we have the right plan to be able to absorb any large number of casualties. So we have been instigating the disaster plan where different hospitals can deal with this, and indeed this was in action 2 days ago, where we had 1,100 ambulances transporting almost 2,000 patients from in different parts of the country, and at one point we were transferring patients from the south of Lebanon to the north of Lebanon, and almost 90 hospitals were receiving those patients. Now, this was something that helped us really absorb these almost 2,500 patients within a very short period of time. And a lot of those patients are still in the hospital. Up till now, we still have 1,343 patients still in hospitals. And when the second attack happened, we were really worried, because if we had a similar, outcomes like the day before, our hospitals would really have been overwhelmed.
Right, and Hezbollah's leader Hassan Nasrallah is delivering his address right now. Our teams are listening in and monitoring, so we can bring you the latest on all those messages from the Hezbollah leader. I want to bring in now Jeremy Diamond, who's in Tel Aviv, and joining us shortly will be Ben Wiedemann, standing by in Beirut. I want to start off with you, Jeremy, and importantly, we're waiting to hear from Hassan Nasrallah in terms of plan of retaliation, what that could mean, as Israel has been very clear about the fact that it's heading into a new era of war. We also know that it's shoring up its teams on the ground at the northern border. Give us a sense of what this could mean and whether we're talking about a potential expansion of this war.
Well, there certainly is that possibility, that very distinct possibility in the air right now, as we are hearing not only the rhetoric ratcheting up, including those comments from the Israeli defense minister talking about a new era of this war, talking about the center of gravity of this war moving north, but also as we are seeing military movements, including the 98th Division, a key fighting force in Gaza over the course of the last year, being redirected away from the Gaza Strip towards Israel's northern front. That doesn't mean, of course, that war is inevitable. And for now, we should note that we haven't seen other key moves that we might anticipate before an all-out war, including, for example, the call-up of additional reservists who would be sent to the northern front. That, for example, has not happened yet. But there is no question that following these 2 days of deadly attacks in Lebanon, the deadliest for Hezbollah since the beginning of this war, with at least 38 members of Hezbollah having been killed over the course of the last 2 days, 33 of whom were likely victims of these pager and walkie-talkie attacks. There's no question that the temperature is very high at this moment, and that Hezbollah, as we are likely to hear from Hassan Nasrallah as he is speaking now, is vowing to retaliate, and that is because they have been so directly hit, not only in terms of the numbers of casualties here, but also in terms of the way in which they have been, their vulnerabilities have been exposed, and they have been embarrassed, and they are weakened by these attacks. Not only weakened from a kind of resources and organization standpoint, but weakened from a public perception standpoint amid when we think of the psychology of this war, the psychology that Hezbollah very much needs to keep in mind with its supporters and with the Lebanese public as well. So we will wait and see what Hassan Nasrallah vows will come in terms of a response, and then we will wait to see what that response will be, because it is that response that will likely determine what comes next, and whether or not we are indeed spilling into that all-out war that has been feared for nearly a year now, or whether these two parties will, as we have seen before, once again step back from the brink.